What about functional MRI? Are they useful now? Could they help with treatment or rehabilitation? Now, there's fMRI, which you can do a resting state fMRI, which looks at activity within the brain. You can also do an action-based fMRI, where you're actually doing some sort of activity, some sort of neurocognitive task while in the MRI machine, and it'll look at the activity within your brain while doing a cognitive task. And so you can do both types of fMRI, and typically what fMRI looks at is oxygen uptake in cellular tissue within the brain. So based on that, it can see which areas of the brain are most active during certain times, and they can look at the patterning of the activation of those areas and try to see if this is different in concussed versus non-concussed, or different, pre-injury versus post-injury, or all sorts of other ways that you could utilize this potentially. The problem that we have with structural imaging techniques like MRI or CAT scan or CT scan is that it looks at the structure of the brain. Following concussion, there is no change in the structure of the brain, and so this is why imaging comes back normal. Concussion is a functional injury, meaning that it changes how the brain functions but doesn't change the structure of the brain. If there are structural abnormalities, which would be found on MRI or CT scan, this would indicate that the brain injury is actually more severe than a concussion. So you're getting into subdural hematomas, you're getting into moderate and severe forms of brain injury versus mild traumatic brain injury, which is concussion, which doesn't have any of that stuff. So the idea behind functional MRI is to look at the brain function. And a standard fMRI will look at, like I said, oxygen uptake in different areas of the brain, and based on that you can look at patterning. There are other types of functional imaging technologies, such as diffusion tensor scanning, PET scanning, magnetic resonance spectroscopy, and some other ones like that. I'll stick to fMRI for today's talk. We can talk about the other ones in the future. Now, the problem with fMRI, okay, it looks at the function of the brain. The problem with it is that brain function can be affected or changed for a variety of reasons. For example, they have found similar patterns of fMRI findings in patients that don't have concussions but have other injuries. So maybe the findings that we see on fMRI are due to pain responses, or just injury in general, or anxiety. So people with anxiety have similar fMRI findings as patients with concussion. And so if the findings are not specific to concussion necessarily, but it could represent or be very similar to other conditions, does a patient that's complaining of mental fogginess, headaches, concussion-like symptoms, if we find stuff on fMRI, does that necessarily confirm that they've had a concussion? Not yet, because fMRI, the same or similar type findings can be found in people with anxiety, depression, MSK injuries, other types of chronic pain disorders, etc. So for example, even on DTI, so I guess I will go into DTI a little bit, diffusion tensor imaging, they found that patients with low socioeconomic status show similar findings on diffusion tensor as patients with concussion. So because there are so many unknowns as to really what we're looking at, we need to do more in comparing different groups with different pathologies or different known diagnoses to try and separate them to know what exactly we're looking at. Because all these studies that come out on fMRI will say, yes, we found differences between healthy control populations and concussed patients on fMRI. Now, the average person reading that study is going to go, oh, there it is. Why don't we just fMRI everyone? The more astute researchers will compare healthy control to a orthopedically injured person, meaning some sort of MSK injury, to a concussion group to a group with anxiety and a group with depression, and then look at the difference between them. And what they'll generally find in these types of studies, which are a little bit more robust, is that the groups that have MSK injury, depression, anxiety, concussion, all look very similar, but they're all different from the healthy control. So that becomes the major issue that we have to overcome, is we can't be comparing concussed patients to healthy control and thinking that we're going to figure anything out. We need to be comparing concussed patients to orthopedic injuries, to people with generalized anxiety disorders and other types of injuries, mental health, chronic pain, all that stuff, because the findings will be similar. So at this point in time, fMRI, in my opinion, doesn't really lend itself to any type of clinical interpretation, because it still doesn't solve the problem as to what is causing this person's symptoms. Is this an anxiety disorder? Is this a psychological issue? Is this a blood flow abnormality? Is this a neck injury? Is this whatever? We don't know.